Veneers are thin ceramic or composite plates that are applied to the enamel and fixed in place with a special cement. There are direct and indirect methods for making veneers. During the direct method, veneers are made directly in the patient's mouth in a single visit. These veneers are called composite veneers. The indirect method is when veneers are made in a dental laboratory. These are ceramic veneers. So, what is the difference between composite veneers and ceramic veneers? Ceramic is a very dense material. It is much stronger than natural enamel. So teeth that are covered with ceramic veneers don't chip. Composite, simply put, is a filling material that is applied over the enamel. Composite material is very porous, so it is easily affected by food colorants or alcoholic substances. That is, consuming alcohol can have a destructive effect on them. Such composite veneers are much cheaper compared to ceramics. For 1 unit, you might pay around 2,000 hryvnias. Ceramic veneers, on the other hand, are much more expensive. They cost about $400 per tooth. But it's also important to understand that the lifespan of ceramic veneers is much longer than that of composite ones. They are designed to last about 20 years. But composite veneers, on the other hand, they need to be replaced every 5 years. It's worth noting that there are many indications for using veneers. This includes discoloration of teeth, meaning when one tooth is a different color from the others. And it's impossible to cover up this discoloration with a whitening lamp, or if there is pathological tooth wear, enamel chipping, the presence of wedge-shaped defects, a large number of fillings. All of these are indications. But first and foremost, of course, it's the aesthetic factor, because everyone wants to look good and have a bright, white smile. So where does the treatment begin? It starts with planning. In our clinic, we distinguish several stages of patient diagnosis. First, there's a CT scan, then a photo protocol. That means we use a camera to document what you came in with, basically your initial situation. After the protocol, we move on to DSD, which is digital smile design, during which we listen to all your wishes. In other words, we model on the computer. We design your future smile. Then, everything we've done, we transfer to a wax up, which is a wax modeling. So, we get a model of your future veneers. After the diagnostics, we can confidently move on to the mock-up. The mock-up is, roughly speaking, a model that will be in your mouth. We transfer this mock-up using special templates in the oral cavity, and the patient can actually feel their future smile. Next comes the preparation of the teeth under a microscope. We have to be as minimally invasive as possible, meaning the enamel is shaped down by just a couple of millimeters to create a base for the future veneer. Once the teeth are prepared, we take impressions and send them to the dental laboratory. This process can take anywhere from 3 to 7 days, depending on the number of restorations you need. Once your veneers are ready, we meet again, remove the temporary overlays, that is, your mock-up, and try on the permanent ones. If you are satisfied with your veneers, and we are happy with them in terms of function and shape, that is, from a clinical standpoint, we move on to the most anticipated and exciting part, fixing your Hollywood smile in place. The fixation of the veneers is done according to special adhesive protocols, and it is very important for the doctor to follow all the rules and not miss a single step so that your dental veneers are now securely and firmly fixed in place and are designed not to chip or break easily. Now, I would like to take a few moments to say a few important words about properly caring for your brand new teeth. Please be very careful when biting on hard seeds or snapping hard objects or opening bottles with your teeth is not allowed. This can damage your veneers. But the same rule applies to your natural teeth, doesn't it? Seriously though, you should brush your teeth twice a day with toothpaste and use dental floss. It's also very important to use an irrigator, that is, to clean all the hard-to-reach places with pressurized water, so that your oral cavity is always in perfect condition. I also want to reassure you in advance, our dear patients. Your own teeth under the veneers do not get damaged or become sensitive, because the veneer fit very tightly to your tooth, thereby protecting it from harmful substances and microorganisms. If you suddenly start to feel sensitivity, it means that at some stage, a minor issue has occurred. But there's no need to worry, because this is a temporary process. We recommend visiting your dentist every 6 months, so your at-home care is not enough. You need a professional, comprehensive approach to keep your veneers in perfect condition for as long as possible. If you have composite veneers, they need to be replaced about every 5 years. Because composite material is porous and it shrinks over time. Minor chips may appear, which we polish out. Yes, we remove them or replace your veneers with new ones.